My name is Claire Davidson. I'm the research lead at Mindset Health. Thank you very much for joining us and doing a Q&A for some Nerva users. For the participants, we're very lucky to be joined by Amy Minogue. She is a dietitian who graduated from Monash University with honors. She is a practicing dietitian and nutritionist with membership in Dietitians Australia. Since graduating, Amy has completed training in GI nutrition, especially in the use of the low FODMAP diet for IBS management. She specializes in nutrition support for gut disorders, as well as support for disordered eating and eating disorder patients. She loves working within this space and helping individuals identify potential food triggers, reduce uncomfortable symptoms, and improve quality of life. So thank you very much, Amy. Did I miss anything in your bio?
No, I think that all sounds perfect.
Otherwise, we're really lucky to have you here. So basically how this is going to work is we've had some Nerva users submit questions to you, Amy. So we'll run through a list of questions and have you answer questions from our users.
Perfect.
Awesome. So the first question is, what are the next steps if Nerva hasn't worked?
Yeah, so with this one, I think the first question that I have back to that is probably what this person has done before trying Nerva. So whether Nerva was maybe the first thing that they've tried to manage their IBS, or if it's sort of a last resort and they feel like they've worked through everything already. So if it was one of their first things, I'd definitely be suggesting, well, I guess firstly, like Nerva can be really effective to reduce and manage IBS symptoms, but yeah, at the same time, there's lots of other things that can influence. And I think that's a really important thing to remember, is that for most people, the sort of triggers of their IBS symptoms is really multifactorial. So for most of the time, we're going to need a few different lenses on to help reduce. So if it's someone that maybe hasn't looked elsewhere yet, and Nerva is one of the first things, there's heaps more they could try. From a diet lens, I guess, yeah, potentially looking at working with a practitioner to help you look at what patterns might be happening diet-wise, bigger picture, stress management, movement, exercise, yeah, lots more they can try outside of that. If it's someone that has potentially looked at a lot of that already, and I guess this is assuming that they have got a nice, clear IBS diagnosis. So maybe they might need to check in back with their GP, getting some updated tests done, just making sure that there isn't anything else that might be impacting symptoms for them. And then, yeah, sometimes just having a fresh set of eyes look over things for you, if it's something you've been struggling with by yourself for a while, can be helpful just to get a clear plan in place. So yeah, lots of other things to try, but it would depend on what they've sort of already tried as well.
Awesome. I have another question here from a user that's, I've struggled to find the right dietitian for me. What's a good question or good questions to ask a potential dietitian to help me know that they are the right fit for me?
Yes. And I guess finding the right practitioner is really important. No matter like who that practitioner is, like same way with a psychologist, sometimes it can take a few to find the right fit and find someone that you're meshing with. I guess what I would say and what might be helpful for them to think about is just thinking about what it was about the past dietitians that wasn't feeling right for them, whether it was that they felt they didn't have the right amount of knowledge to support them with what they were needing, or just sort of personality wise, they feel they weren't meshing or clicking, because then you can sort of be specific with your questioning or, what you're looking for once you've got a clear idea of what you want. A lot of dietitians these days do specialize in certain areas of nutrition support. So yeah, I guess a first start, if it's gut support that you're looking for, would ideally be finding someone that's sort of openly marketing themselves in that gut space. And just, yeah, having a think about what you're hoping to get out of those consultations and what your nutrition goals are. Because a lot of the time, well, you should be able to either sort of ask questions before booking, or often you might be able to do a bit of a discovery call to chat with the practitioner. But if you've got a nice, clear idea of what your goals are and what you're wanting out of it, so you can communicate that to them, I think that will help. Yeah. get rid of some of that miscommunication, I guess, in terms of what you're wanting out of the session. But yeah, and I mean, well, in theory, if someone's coming to me and I don't feel I can properly support them with whatever specific condition, we should be able to sort of refer on to other colleagues that specialise. So if you're being nice and clear, the dietitian shouldn't take you on, I guess, unless they're able to support with that. But yeah, the personality side of things, sometimes that's just a matter of testing a session out before you know that. But checking out their social media, their website, often you can get a bit of a idea from there if they're going to be a nice fit or not.
Just off the back of that question, how can patients know if a dietitian is the right healthcare provider versus going to see your GP or a gastroenterologist or another kind of specialist?
Yeah, and it can be a tricky one. And I guess that's the tricky thing about IBS in general, because even getting a diagnosis in the first place can be a bit of a grey area. I guess definitely if you're thinking you have IBS, starting with your GP is often the best place to start, so they can do that sort of initial screening. Your GP should then be able to give guidance on whether they think a gastroenterologist might be necessary. Often, unfortunately, what I might see though is someone might get a vague IBS diagnosis and then they're kind of just sent off by their GP. Again, if you're heading towards a dietitian that specializes in the gut space, a big part of what we can do in that first session is just that general, I guess, history taking, but looking at that bigger picture for you and drawing all of that together and giving you a bit of direction as to whether we think diet might be the best place for you to start with. If we think, you know, stress or anxiety is impacting more, we might refer you over to a psychologist, or if there's some screening or testing that hasn't been done first, send you back to the GP. Definitely, yeah, GP first, and then from there, I guess, yeah, a dietitian can definitely help with that screening further and refer on if needed alongside what they can do with diet.
Awesome. How do I know what type of diet is right for me and my IBS?
Yes, potentially a frustrating answer for people to hear, but there isn't a one-size-fits-all diet for IBS, unfortunately. There's definitely common things that we know impact symptoms and seem to work to improve symptoms for a lot of people, but majority of the time it's going to be a bit of trial and error and working through that to find out what specifically impacts symptoms for yourself. And again, just to the point of like, it is often multifactorial. So while diet might be playing a role, it's often not the only thing that's influencing symptoms. And we definitely want to be trying to avoid restricting the diet unless we really need to. So in terms of a dietary pattern, like thinking broadly, like just, you know, choosing good quality foods that are giving nutrients and fiber and nourishing, looking at the bigger dietary patterns as well of, you know, regular meals, how you're eating, are you chewing well? And then from there, I guess it would be funneling down, but there's no one answer I can give because it really depends on someone's triggers. But generally, yeah, what you want to do is sort of look broad to start with, look at the other non-diet impacts as well, because for some people, just starting broad can be enough to manage their symptoms, which is awesome. But if not, we've got that good foundation from, yeah, strong dietary pattern, you know, we're controlling sleep, stress, got some movement happening, ticking all of those boxes before we would look at any specific restrictive diet, say like a low FODMAP diet, because, yeah, you don't want to jump to that before you've got everything else in place, because you might not need to. But also, as I said, it just gives us a nice strong foundation to then build on with those extra layers of restriction if we need to. And yeah, again, with a low FODMAP diet can be tricky to go through on your own. So getting some support if you're looking at any type of restrictive diet, just to make sure you're doing it sort of safely and to a good timeline is really important.
Yeah. Off the back of that question, I think this follow-up question is really nice after that. The low FODMAP diet is too restrictive for me as a person with a history of an eating disorder. Can you offer advice to this lens?
Yes, really good question, and just a really good point to make. And again, which is why, like, we never want to go to a restrictive diet unless we need to, for someone's enjoyment of food, but also, you know, for lack of nutrients. But that, yeah, relationship with food can really be impacted. And it is something we commonly see with gut or gut disorders and potential disordered eating patterns, or just, yeah, a bit of a negative relationship with food. So especially for someone that has a diagnosed eating disorder or can just recognize that, yeah, maybe their relationship with food isn't so helpful, I think, yeah, definitely looking at working with a practitioner, so a dietitian, to help you through that. Because, yeah, restricting the diet isn't always needed. There's lots we can try outside of that to improve symptoms. But if we feel we do, like we think that there might be some specific components that are triggering symptoms, say some high FODMAP foods, we'd want to do that really carefully. And we can take modified approaches as well. So it doesn't always have to be, that full strict low FODMAP protocol. Sometimes I might just recommend some swaps to someone without even mentioning, a low FODMAP diet to them. So we're just looking at swaps without them being fully aware or, feeling like they're on a restrictive diet. But I think, and potentially linking back to the question at the start of sort of finding the right practitioner, within that space, really important to have a practitioner that you can trust so that there can be that open communication both ways, dietitian explaining what's happening, why we're doing it, and having that check-in of where that's sitting with that relationship with food. Because, yeah, definitely the last thing we would want to do would be to sort of flare up any disordered eating patterns as we're trying to reduce gut symptoms or vice versa. So, yeah, really good question, and something I guess that everyone should be aware of, just considering those broader impacts when we're doing any sort of restrictive diet.
And can you speak a little bit about the low FODMAP diet in general? I know you spoke briefly about how, sometimes a modified version of it is right for patients and not necessarily the full protocol. Can you speak, if a patient is coming to see you and you do recommend a low FODMAP diet, what that typically looks like for them?
Yeah. So just to touch on what FODMAPs are, maybe if there's people that don't know, they're different types of carbohydrates or sugars in certain foods. And basically, in most people, our gut doesn't absorb some of them very well. That can draw a bit of water into the bowel, or as they ferment with our gut bacteria, we might get a little bit more gas production. In someone without digestive issues or IBS, FODMAPs are actually really healthy for our gut because they help to feed our gut bugs. So that's really important to note. It's just that in those with IBS, that process of as they're moving through and interacting with our gut bugs can sort of set off that hypersensitivity that we see within the gut, contribute to pain or extra bloating or changes to bowel movements. So, yeah, really important to remember that a low FODMAP diet isn't just some sort of healthy diet that we should be following. It's only to manage symptoms. So if we're going through the FODMAP process, what that would look like is a restriction period. Normally, I find somewhere between 2 to 4 weeks is long enough, but definitely no longer than 6 weeks. And within that restriction period, we'd be pulling back on the total FODMAP load in your diet. And I think that's another important thing to remember is a low FODMAP diet, even if you're following it perfectly, you've still got some FODMAPs in your diet. So it's not this kind of completely strict all or nothing approach, but it's just about reducing that load on the gut. We'd see if your symptoms settle. If we get some good symptom improvement in that first period, then we would go through the FODMAP challenges, which can take a couple of months to work through because we want to test the foods back in, see how your body's responding because everyone is different. And then once we've got all of that information, the last step is to reintroduce back in the diet. And usually there should be a few groups that you're tolerating well, that we can get back in normal quantities. And for the others, just working out what that individual sort of threshold level is for yourself. But the goal at the end is to always get as much of them as we can back in the diet for the person's enjoyment of food and just flexibility, but also to support gut health because we know that, yeah, variety of fiber and particularly those higher FODMAP foods are really good for supporting our gut bugs.
Awesome. I have another question related to the low FODMAP diet. It's very popular today. I've been following a low FODMAP diet for 6 weeks and started medication from my GP for the past 3 weeks. If I vary my diet at all or don't take the medication, I again have very loose stools and abdominal pain. What should I do now?
Okay. One question I have for that, I guess, is sometimes when we've got a couple of things going on at once, it can be tricky to know what's caused the improvement or what sort of shifted things around. So I would be wondering, say in that first 3 weeks of low FODMAP before they started the medication, what was happening with symptoms then? Was there already improvement before the medication, or do they feel that maybe the medication is a key part of the improvement that they got? Be wanting to check, I guess, where they're at with the low FODMAP diet, if they were following that strictly, and how much improvement they saw with that. But then in these patches where they're varying outside of that with their diet, is there a specific food that they're having that seems to set them off, or is it just a meal that may have multiple FODMAPs in it? Because I guess if they're around that 6-week mark, we don't really want to be staying on that restrictive low FODMAP period for too long. So either way, I'd be wanting to look at, let's start to do some kind of controlled challenges to step you outside of that, because for most people, you're not going to react to every single FODMAP group. It'll just be a few key culprits within that. So going through that challenge process, as long as we've got a clear enough baseline to work from, would be helpful. From a medication perspective, I guess just checking in with your GP what the plan was for that, depending on what the medication is. Is this meant to be a long-term thing that's staying in? Was it a short-term trial? And again, sort of similar way to how we do FODMAP challenges or, determine food intolerances, discussion with your GP, but then looking at, again, depending on what the medication is, trialing a period of time off it, just so we can get a clear idea of, is that the thing that's having the main impact? Is it the FODMAPs coming in and out? But either way, working through the FODMAP challenges to start to broaden the diet and get a clear understanding of exactly what it is that's triggering when you're stepping outside of it, because it's unlikely that it's all of the FODMAPs. So there should be some room to move from there.
A couple of follow-up questions to that. One question that came through the Q&A, could you please just explain what a FODMAP challenge is? There's a lot of question about what that is.
Yeah, good question. So we've got that initial restriction period where we pull back on all of the FODMAP groups. So there's 6 different FODMAP groups and we'll lower them all in that initial phase. During the challenges, what we want to do is work out of those 6 FODMAP groups, which ones seem to set your symptoms off. And again, as I said, for most people, it's only going to be a few of them, not all of them. So the way that the challenges work is we would typically choose one food under each of those FODMAP groups to challenge. And that food is chosen because it's high in just that one FODMAP group. So we kind of nominate a food to be the tester for that group. Can definitely vary between foods, but as a starting point, that's what we'd be looking at. So during the challenges, the diet would stay low FODMAP. So we've got a nice controlled baseline. Ideally, your symptoms have settled from that initial elimination phase. And then there would be a set amount of a food that you'd have back into the diet in a controlled way, which normally looks like having a set serve of it once per day for sort of up to 3 days, taking note of your symptoms, having a washout period in between before you go to the next challenge. You kind of want to think of that as we're just like collecting data. So put the food in, observe what's happening, take some notes, take it back out. So the baseline diet stays low FODMAP until you finish all of the challenges.
Can you also speak a little bit to those patients that have done really well in the elimination phase of the low FODMAP diet and might be nervous to enter that challenge phase?
Yeah, can be really normal and very understandable, I think. So not being too hard on yourself because, you've restricted your diet, you've got this patch of feeling awesome, your symptoms are settled. So it's kind of like, why would I want to potentially put something back in that's going to set my symptoms off? But at the same time, it's so, so important to move through that. And again, that's where having someone that can guide you through that process to make sure that it's not getting extended longer than it needs to, that we've got the right foods and the right amounts of foods to get nice, clear results. Because I think that's something that can happen when people are a bit unsure of what they're doing, is it just gets drawn out and you're unsure of what you're seeing. But it is really important so you can get that information, because otherwise it's very likely that you'll end up eliminating foods that don't need to be eliminated because you probably do tolerate them okay. And it just makes, I guess, heightens that anxiety that we can see further, because we've got this big group of unknown foods where you don't know if you have it, how it's going to go. Whereas the challenges coming out the other side of that, ideally, it should be really nice and clear of, these are the foods I tolerate. These are the ones that just give me mild symptoms. So I know, if I have a little bit here or there, might be a bit grumbly or gassy, but it's okay. Versus these are the foods that are my key triggers and I do need to avoid. Because there is that risk as well of, if you're eliminating these high FODMAP foods long term, you can actually end up making yourself more sensitive to it, because your gut bugs aren't sort of being exposed to it and having that exposure to digest and know how to digest them well. So totally understandable that it's scary, but at the same time, so important to step through that process.
Does it make any difference in the form that patients have high FODMAP foods? Like, for example, is garlic and onion powder or spice form any different to fresh garlic and onion?
Yeah, so to a degree, yes, the form matters. With garlic and onion, unfortunately, they're just pretty potent in FODMAP. So most of the forms do need to be avoided. So when it comes to sort of fresh or like the powdered forms that you might get in sort of spice blends or in stocks and things like that, are all going to be high FODMAP. What you can use though is the garlic and onion infused olive oils, because the FODMAPs in garlic and onion are water soluble. So with the oil, we get the flavor going into the oil, but the FODMAPs don't go into the oil. Outside of garlic and onion though, again, along that sort of water soluble line, canned foods, so canned like beans and legumes and lentils, or if you're sort of boiling and draining, I guess vegetables as well, but yeah, beans and legumes, that can reduce the FODMAP load a little bit, because some of them will leach out into the liquid. So as long as you're rinsing from the can well, that can reduce them a little bit too.
I suffer severe pains when I eat onions and garlic. Is there any way I can limit the pain apart from not eating anything which contains onion and garlic?
Yes, garlic and onion is a really sad one when we're sensitive to that, because it's just hard to avoid. Like other, I don't know, fruits or veggies and things, it's easy to ask, without mushrooms or pick it off something. Whereas garlic and onion, because it's often in like our sauces and marinades, it can be a bit trickier. So what I would be wanting to look at is, I guess, what else might be influencing your IBS in terms of just general sensitivity and getting that like, overreaction of the gut to sort of calm and settle. So that might look like, bigger picture sort of stress management, broader dietary patterns, just making sure we're doing what we can to have the gut sort of be calm, moving through nicely. But the other side of it, I guess, is looking at what we can do to try to build your FODMAP tolerance. So as I sort of touched on before, with our FODMAPs, that like longer term strict restriction or elimination from the diet can end up making you more sensitive to it in the long run. So what you would be better to do is see if you can find your sort of threshold, with the idea being of like having some coming through the diet, but only enough so it sort of flies under the radar. So it might seem like a really small, insignificant amount, but enough to expose the gut bugs to it, but not enough to sort of tip you over into that point where you're getting symptoms. And with time, what we can see is just those really little bits of exposure can sort of build your gut bugs tolerance to digest them well. And you might find that like it can take a while sometimes, but you might find that you start to be able to tolerate a little bit more and a little bit more as the months go. So that's definitely one side of it, is as much as possible, if you can find a little bit of a sweet spot in there, exposing your gut to it as much as you can, rather than just restricting, long term. But then just looking at what else we can do to support the gut microbiome and make sure we've got enough of the types of bacteria that are going to help you digest that well. So we can touch on that a bit more, but that could just be broader strategies for gut health and looking at enough fiber coming through the diet, variety of fiber. Maybe it might look like some supplements shorter term, so some specific probiotics or prebiotics to help support there. But definitely doing everything that you can to help build that tolerance rather than just that strict avoidance moving forward.
Can you speak a little bit about the role of stress and anxiety management in
Mm,
managing IBS symptoms, and specifically in a Nerva user who submitted a question that said they've done well with the low FODMAP diet, but are
mhm.
curious about the role of stress and anxiety management on top of that?
Yeah, yeah. And I guess again, it really depends on the individual and what's going on for them. Like we know a big part of IBS is that miscommunication between the gut and the brain. So without a doubt, yeah, it's very clear that stress and anxiety plays a role, but that can be to varying degrees. So for someone that can, yeah, really identify that, whether it just be that they've got a high stress job or, juggling life, or they really do suffer with severe anxiety, whatever it might be, that would sort of guide how much focus we might put on that. But it's always a discussion that I'll have with someone, and just making them aware that it's definitely can be a key player. And there are times where maybe I might have a session with someone and we're chatting, and I might not give them much to look at with diet if we can notice that there's a lot of stress going on, and some clear patterns around that. Um, if someone's had some really good results with Nerva, was it Nerva that you said, or FODMAP diet that they've had good results with?
This
The
user
FODMAP?
specifically was talking about FODMAP, good results with
Yep.
FODMAP.
Yeah, yeah. Um, if you've got sort of full control over symptoms through the FODMAP diet, I think the way I would be looking at sort of Nerva or stress management, again depending on what's happening in their life, if it's not maybe so prominent but they've just heard that it can be helpful, is just to look at those small sort of day-to-day things you can do. And it's sort of thinking preventative as well. Like we don't want to wait until we're stressed and anxious and crumbling to be doing these things that are good for our mental health. So, that might look like some short meditation each day, making sure you've got good mealtime behaviors of, eating in a relaxed environment, slowing down, chewing well. But then, like, often I might use Nerva for someone if they've done the FODMAP diet first. Maybe they've got some clear results, but they're struggling to be able to sort of build their tolerance to things. Is I might suggest Nerva at that point in time, again, to help sort of calm that response from the gut. Because if we can get the gut digesting better in the first place, we're going to have better tolerance of food. So that's the way that I always sort of like to describe a FODMAP diet, or whatever sort of restriction we're looking at, is that's kind of helping to settle our symptoms, but it's not looking at the root cause. We're pulling out the FODMAPs to get you feeling better short term, but we always want to look at how can we improve that underlying function of the gut to, yeah, continue to get you feeling better, but so that we can get foods back in. Because at the end of the day, FODMAPs are only a trigger or something we need to take out of the diet because the gut's not functioning underneath that. So it's not that they're kind of, our root cause or like the answer. So yeah, if she's feeling that she is struggling with some tolerance of foods, or if there's no harm in doing Nerva, it's likely to do good. Very, very unlikely to do any. Well, it's not going to do any harm. But other than that, yeah, just looking at some day-to-day things you can do around, meditation, relaxation, that sort of bigger picture stress management would be good.
Awesome. I have a question here about coffee and IBS. This user
Mhm.
said, I've read conflicting reports regarding IBS and coffee. What are your thoughts?
Yes. Um, Often this comes down to what sort of symptoms someone's getting. I'll come back to that, but outside of the symptoms, I guess following on from that conversation we just had around the gut brain connection and stress and anxiety, would just be considering the impact of the caffeine on the nervous system. And that for some people, that can kind of exacerbate that stress or anxiety response in the body. So if you feel that you're quite sensitive to caffeine, that would definitely be one thing to consider. The other way to look or think about coffee is the effect that it can have on the bowels. So, and sometimes this is where it can be sort of one way or the other, in that for someone that's maybe got fast movement through the bowels, they've got urgency and looser stools, coffee is probably not going to be so helpful for them because it's potentially going to speed up that transit through the bowel even further. Whereas for someone that's maybe got quite slow transit or sluggish bowels, so that constipation type picture, and assuming that they're sort of not sensitive to the caffeine in a stress, anxiety inducing perspective, the coffee can actually be helpful for these people because it can help sort of get the bowels moving and stimulate and support them to have a bowel movement from the effect of that caffeine. So can go either way there. More commonly, I would say coffee might not be helpful, but there's definitely times where for some people it can be helpful if we're looking at encouraging some movement. And then the other thing with coffee is it can have the effect of increasing our stomach acid production. So for someone that's maybe suffering with acid reflux or heartburn, it's just something to consider in that picture as well. But yeah, as you're probably picking up from a lot of these answers, it's not a one size fits all. So it really depends on what symptoms someone's presenting with and how it impacts them individually.
Just a follow-up question from the Q&A box. Is what you're speaking about with coffee, is that just specifically for coffee or all caffeine?
All caffeine to a degree. Again, obviously the amount of caffeine in different beverages can vary. And yeah, again, it really depends on the individual. Some people seem to go fine with caffeine and it doesn't affect their urgency or bowels. Other people can be quite sensitive to it, or they've got, a good understanding of, a coffee from the barista is going to be higher in caffeine. So it's definitely a no-go. But if I'm doing, a bit of instant coffee or a pod coffee at home or a, green tea, whatever it might be, that level's okay. Sometimes like empty stomach versus having food, the strength of it, even like what's happening on that day. Like we know that IBS symptoms can flare. So for some people, if everything else is pretty calm, they might be able to tolerate caffeine okay. But if they're in a bit of a flare or, it's a stressful time or their food's a little bit out of the ordinary, a coffee might tip them over the edge in those sorts of situations. So it does just take a bit of trial and error to work out what's going to sit okay for you.
Awesome. This user's chief complaint is bloating. Can you speak about the best way to prevent bloating after meals?
Yeah, the first thing I'd probably be thinking is just if there's a particular food component that might be causing that. So I guess that could be something high FODMAP commonly, could also be something outside of it. So if they haven't already, maybe doing a bit of a food and symptoms diary, just to see if there's any patterns between the meals that maybe are sitting okay versus not. Sometimes it can be a matter though of it's not a particular food component and it's just how the gut's responding to digestion in general. Like it could be any food or meal or liquid moving through and they just seem to bloat, and it can be really hit and miss with what it is. In those situations, we sort of want to be looking back at, that overall digestion and functioning of the gut. So definitely looking at that sort of gut-brain axis, stress, anxiety type picture, and bigger picture things we can do to help manage that. But often a really big one that can, sound so simple, but often get really good results with clients is just focusing on what's happening around the actual mealtime and how you're eating. So making sure that that's a nice, calm, relaxed environment, taking a few deep breaths and just physically relaxing the body, making sure your belly's relaxed, that your pants aren't too tight, unbutton them if you need to. So again, if we're looking at that sort of nerve hypersensitivity, if we've got restrictive clothing on, that can sometimes be a bit of a trigger in that picture. Speed of eating, so just slowing down, making sure you're actually chewing each mouthful really well. The chewing's a really important one because I guess that kickstarts digestion. We've got enzymes in our saliva that help to break down food, and that sort of sends messages to the rest of the gut to let it know that food's coming. But the more we can like physically break down the food with our teeth, the less work the rest of the gut's got to do. And often that can be a cause of bloating is when we've got big chunks of food moving through the intestines that aren't broken down properly. They're more likely to have that sort of fermentation reaction and produce gas further down. So looking at the stress, but then really looking at how you're eating, slowing down, chewing really well. Outside of potential dietary triggers.
I have a question here about fiber. How much fiber should I eat to manage constipation? Some recommend an increase in fiber to help, while others say it could make things worse.
Yes. With fiber, there definitely is a thing as too much fiber. So yeah, we always want to be mindful of more isn't always better. But it also depends on the type of fiber that we're having. So our two main types of fiber that we see are our insoluble fiber, which are kind of like our dry roughage type fiber. So more like the skins on fruits and veggies, like husk, whole grains, those bits that we might see kind of come out the other end in the toilet bowl. And they give us bulk to our poo, but they're quite a dry type of fiber. So if we're looking at constipation, if we've got a lot of these insoluble fibers coming through, maybe someone's not drinking enough water, our stool can get really bulky and firm, really hard to pass and just hard for it to move through the bowel. But we've also got our soluble fibers, just sort of our softer types of fibers that are more spongy. And these can work both ends of the scale. So for someone with sort of watery, looser stools, the spongy fibers in our soluble fibers can help soak up some of that liquid in the bowel. But for someone with constipation, they're going to help hold some water in the bowel and make that stool sort of softer and easier for them to pass through. And that might be things like oats, chia seeds or flax seeds, psyllium husk to a degree, and more like the softer flesh of your fruits and veggies is where we'll get that soluble fiber. So again, it depends on the individual's diet, but it's kind of that like sweet spot in the middle. We want enough fiber, not too much because you can go too hard, but just making sure we've got a nice balance of some of those insoluble fibers, but it's generally the soluble, softer fibers that we want to look at adding a bit more in for someone when they've got constipation. And that could be through their diet as a starting point, combined with making sure they're drinking enough water. Or we might look at a supplement shorter term for specific types of soluble fibers that we know can be helpful and can sometimes just be an easy way to top up when we're working with other sort of dietary restrictions or triggers in the diet too.
I have a question here. This user has identified that fried food is the cause for severe symptoms. This user is just wondering if this will always be the case or if this will improve over time.
Hard to say. And I guess that, again, can be quite the frustrating thing is often we can definitely get IBS to a point where things can be really well managed and we feel like we've got a good grasp on it. But there's no, per se, like cure for IBS to make it go away completely. If that's sort of one of their main triggers and there's not a lot else that seems to set them off, I, again, would sort of be looking at that picture of what's going on underneath that with the functioning of the gut, looking at how they're digesting outside of fatty foods, but just anything we can do to, I guess, help support overall gut health and the gut microbiome, support that gut-brain axis, nervous system response, because we know that that's, a key reason why things can kind of set off or be a trigger in the first place. So looking at managing stress and anxiety, good mealtime behaviors, potentially Nerva if that's something you haven't explored. We know that that can help to settle that response. And then I guess within the fatty foods, as frustrating as it might just be that one thing that you do need to limit or be mindful of. The total load on the gut though as well. So it might mean that, I don't know, say it might be like if you go for fish and chips type situation, maybe see if you can do some grilled fish with the chips. Yes, the chips have got some fat and oil, but when it's a bit less overall, or you've got some salad or veggies coming in with it, it might help soften it so you don't have to miss out completely. But the load of the food at that one point as well will make a difference.
Awesome. Question here, is sourdough bread generally easier on the gut and IBS symptoms than normal bread?
Yeah, in a short answer, it can be because it goes through that fermentation process when it's made. So we've got the fructans, which is the FODMAP in our wheat. So that can be a trigger for some people, but that total amount of that gets reduced in sourdough through that making process with the fermentation. So compared to like regular white bread or whatever it might be, it can be a lower option,
Couple final questions here. We're near the end. You've been a champion so far.
That's okay.
What are your thoughts on non-FODMAP food triggers? Seems like all the focus is on FODMAPs, but I find some low or no FODMAP foods that irritate my IBS symptoms.
Yeah, so again, good point, because often IBS can, FODMAP diet can be the thing that's harped on a lot in the IBS space, and it sometimes seems like it's, the only diet. It's definitely not. For a lot of people, it can be, or some of the FODMAPs can be a cause of their trigger, but not for everyone. So what we want to do, and what I normally sort of do with clients, is before we even look at FODMAPs, is just look at those broader patterns of foods for IBS. So a lot of the time that might be like heavy fatty foods or oily foods, spicy foods for some people, looking at coffee, alcohol, those sort of more common things. The next layer often would be a low FODMAP diet, because it does incorporate a lot of the common triggers that we see. So it can just help, I guess, if it's followed properly in that timeline, it can take the guesswork out of it and make it quicker, because we kind of wipe out all the common triggers in one go and we can clearly see what's happening. But then if we find that someone doesn't get enough improvement with the FODMAP diet, so it kind of sounds like this might be the case for this individual, is at least then we can know, all right, well, these FODMAP foods aren't a trigger, and it helps us really narrow it down then. So what I'd be wanting to look at is, if this user's maybe got a clear idea of exactly what non-FODMAP foods are triggering, the help of a practitioner or a dietitian might be helpful here, because then we can sort of look at it with a different lens of what are the other components in these foods that might be triggering, whether that be from a food chemical perspective or something else that we can see within that we might need to step to. Sometimes there might not be any pattern, and for some people they just have a few random foods that don't fit any particular picture but that are just triggering. But triggers for IBS definitely don't always fall under FODMAPs. They commonly do, but they can definitely be things outside of FODMAPs that can trigger.
Question here about a user that struggles to do the introduction phase of the FODMAP diet, finds it's too restrictive, and the user can't fully do the restriction phase. Will the low FODMAP diet still be effective? Will I still be able to tease out the foods that are causing symptoms?
Okay, and so by reintroduction, I'm guessing they're talking about that sort of middle phase where we're challenging things back in. Again, I think working with a practitioner, if you're not already, is probably going to be helpful here, because there are sort of modified ways that we can look at doing it. Because I guess we've got that sort of 2 to 4 week restriction to get started, which often people are sort of motivated and it's just 2 to 4 weeks, so it's a bit easier to follow. But then it is a bit of a chunk of time to go through those challenges, so that can end up being sort of 6 to 8 weeks, where ideally that baseline diet is a controlled low FODMAP diet. So just making sure you've got all of the support to make that as easy as possible and practical. I'm wondering if maybe some of that's missing, and that's why they're feeling that they're struggling there. But otherwise, we can look at doing like a bit of a modified approach for the challenges, and maybe testing some of the like broader things first, so you can start to incorporate some little bits of those back in your diet if there's a particular food group you're sort of struggling with the most to keep out. That would often be my way of doing it with someone, is looking at what are the food components they're really struggling to avoid most, see if we can test them early to get a good idea of if they're triggering or not. And if they're not, we might be able to incorporate some of those throughout the challenges, still making sure we keep a bit of a balance so we can get some clear results. But it's kind of like, you've come this far, it's obviously helped to settle symptoms if you're, still continuing with it and looking at doing the challenges. So it's just, getting through those last few weeks so you can get that information and step out the other side of it. But there's definitely modified ways you can do it to make sure that it feels okay.
I have another question here. This user says, I have done well with the Nerva program and a modified low FODMAP diet, but I'm traveling in the near future and I'm worried that symptoms are going to flare up. Do you have any advice?
Yeah, tricky one. And I think it's that feeling again of when we do that FODMAP process, same way as where people might have anxiety going into that reintroduction or challenge phase, is we feel really comfortable when we've got control over everything and our symptoms are settled and everything's, nice and stepped out. But then it can be really scary to, step outside of that and eat meals out that maybe you're not 100% sure what's in it. Depends on the timeline, I guess, of where they're at now in that process, how far the trip is away. But often for clients that are in a similar situation to this, what I'd be looking at is before they leave, at a minimum, trying to get a really clear understanding of what foods trigger and how much they can have before they trigger. So at least it takes that unknown out of it and they can make some informed decisions when they're going. And as I said earlier, it's that thing between, you might have some foods where if you have some of it, it might just give you, a little bit of gas or just some symptoms, but they're manageable. And so might be okay with having those here and there while you're traveling. But what we want to do is work out what are the foods that really set you off. So, as much as possible, they can be avoided. Also, just a bit of a, maybe discussion or prep yourself of, where you're going, what types of foods. Like, it really depends where they're traveling and what, cuisines are available and how easy it would be to avoid triggers and modify. But then also just looking at the things that they can do outside of direct food triggers to manage symptoms. So again, as I said multiple times, just those bigger picture things around good mealtime behaviors, making sure they're still eating regular meals while they're away, they're not overfilling the stomach in one go. Maybe it might mean a bit of a fiber supplement they can take as a top up, because sometimes we can struggle to get enough fiber in while we're traveling. Again, depending on what their symptoms are, it might mean some supportive things like some peppermint oil capsules, or just those things that might not mean that it's completely, avoiding a flare in symptoms, but can help soften the severity of it. But for a lot of people, I find it's that unknown that can really contribute to that sort of fear around traveling or stepping outside of their usual day-to-day eating patterns. So we can get as much information as possible before those situations happen. It can just, help you to feel more in control and like you've got that ability to make an informed decision and sort of know what's ahead.
Awesome. Last question here. Can you speak to which patients you refer to the Nerva program? Is it all patients with IBS, or are you looking at a certain subset?
That would, depend on the assessment and what's happening for them. I think, I find Nerva super valuable for patients. And I might use it at different times throughout their treatment process. So as I mentioned earlier, for someone, if they're coming in and maybe their symptoms are really hit and miss in that they can eat a particular meal one day and it sits totally fine, and on another day, it really sets them off. Often that to me indicates that it's probably not anything in particular in that food that's setting them off, but it's that general sensitivity of the gut. Or if, we can just clearly see that there's a lot of stress, anxiety, etc. going on for this person. That's where I might look at doing Nerva or suggesting Nerva to them earlier. Maybe we might make some little modifications with, mealtime behaviors, patterns, maybe just bump up their fiber and fluids a little bit and get them to do Nerva earlier on and see how they go. Because again, I've always got that lens of, I don't want to restrict anyone's diet unless we need to. So it's always thinking about what can we do that's going to be, least disruptive and restrictive in that manner. And then again, as I mentioned earlier, the other way that I might use it is if we've gone through the FODMAP process or, whatever it might be, someone's got really good symptom improvement and we're looking at it from a lens of just helping to improve their tolerance to foods and reduce that sensitivity of the gut out the other side of it, I might look at referring them to them later on. But so really sort of depends. Important that they've got a clear IBS diagnosis to begin with. Definitely for people that have, clear stress, anxiety, elevated, more often than not, I'm definitely sending them over. And then for others, just sort of depends how things progress and what their sensitivity levels are like out the other side of whatever diet approaches we're taking.
Awesome. Thank you so much. This was incredibly helpful and incredibly insightful. We will send the recording of this to everyone who signed up, and then we will also send Amy's information. Like I said in her introduction, she's an excellent dietitian, and you know, a lot of the answers to these questions are very personalized and really depend on the patient. And working with a dietitian like Amy is oftentimes the best route for really individualized health information. So thank you so much, Amy.
Thank you
Really,
for
really
having me.
appreciate it. Yeah, this was
Thank you
great.
so much.
Thank you so much.